guys, it's Dr. B again. Today we're going to continue our discussion on the shoulder. We're going to talk a little bit more about the anatomy, in particular the 3 different variations of the acromion and how that can put you at more risk for an impingement syndrome or some other type of rotator cuff pathology. So let's look at the drawing. Right here, this is the posterior aspect of the shoulder, or the back. So if I face the board and you look directly at me, that's exactly what we're looking at. So this is your humerus, that's this bone right here. This is your clavicle right here. So one of the most common muscles that's affected in an impingement syndrome is the supraspinatus. So I'll show you what that looks like and I'll break it down so it's easier for you to remember. Now the supraspinatus is this muscle I drew in red right here. It attaches onto your shoulder blade or your scapula right above the spine and hooks over here and attaches to the top of your humerus. Now, an easy way to remember supraspinatus is if you break it down, sup is short for superior, which means above, and spinatus, spine, that's this portion on the scapula. So you put it all together, supraspinatus, nice and easy to remember. Now, let's talk about the 3 variations. The space that's affected in an impingement syndrome is what we call the subacromial space. That's the space below the acromion and above the glenohumeral joint, especially at the head of the humerus. So in the flat variation, which is what you want, that's the most common, you have tons of space for this tendon to come through and attach onto the humerus. And then if you get to the curved variation, variation number 2, which is not as common and you don't have as many issues with this, you see that the space begins to narrow. And then if you get to our 3rd variation, the hook variation, which is hopefully what you don't have, there's essentially no space right there. So like I said, with the curved and the hook, you can be born with these types of variations, although this one can be exaggerated if you have some sort of bone growth on the end of that acromion process, like an osteophyte, which is going to enhance the hook nature. So you see right there, no space. Now let me talk about basically your posture and how this can also affect an impingement syndrome. So you can create the most space in that subacromial area when you externally rotate your shoulder and you bring it back kind of in this manner. Now you can decrease that space, and when you have the least amount of space there is going to be when you internally rotate your shoulders, and especially when you bring it, across your midline like that. Now, if you kind of have that, hunchback of Notre Dame posture, or you're in the gym and you only do pecs and you don't do any work on, your rhomboids or anything like that, you're going to have this exaggerated posture like this, which, like I just said, puts you in the least favorable position, which is going to close that subacromial space, making you more susceptible to an impingement syndrome. I hope this video was very informational. I hope it helped. If you have any questions, please feel free to contact me on Instagram or Twitter @TheSportsPod, #AskDr.B. Have a good one.